দেখুন স্যার হয়ে গেছে।
ইন্দ্রদা হ্যাঁ বলুক তবে তো।
Your meeting should start in a few seconds. আসছে জুমে জয়েন মিটিং এসছে, আমি মোবাইল থেকেও জয়েন করে যাচ্ছি।
হ্যাঁ জয়েন করে যাও।
আবার জুম ডাউনলোড করছি, দাঁড়া।
না, মোবাইল থেকে জুমে যেতে হবে না স্যার আপনাকে, আপনি তো ল্যাপটপ থেকে জুমে আছেন, আপনি
তুমি
মোবাইল থেকে ইউটিউবটা খুলুন।
ইউটিউবের লিংকটা ডাইরেক্ট ক্লিক করে চলে যাবে। 59 হয়ে গেছে মার।
হ্যাঁ আমি দিয়ে দিয়েছি আপনাকে, সেকেন্ড যে লিংকটা পাঠিয়েছি হোয়াটসঅ্যাপে ওইটা খুলুন স্যার। আপনার জুম তো আপনি মোবাইল থেকে আছেনই, এই ল্যাপটপ থেকে তো আছেন।
ইউটিউবে ঢুকে যা। 59
হ্যাঁ হ্যাঁ ইউটিউবে ঢুকে গেছি স্যার।
অন স্ট্রিম হয়েছে?
হ্যাঁ লাইভ আছে স্যার।
এখন লাইভ আছে। ইন্দ্রদা
হ্যাঁ
বলতে
লাইভ আছে, ছবি দেখা যাচ্ছে, দেখুন।
ইন্দ্রদা শুরু করো।
ঠিক আছে, গুড আফটারনুন এভরিবডি, wherever you are. This is a special webinar being arranged by the West Bengal Orthopedic Association, and this is on a very pertinent topic, and that is what we are all facing today. আমাদের সকলের সামনে this problem has come along. একটা জিনিস তো প্রথম থেকেই বলতে হবে that we are not prepared for it. We were not prepared for it. We didn't know much about it. We most of us কেন সবাই আমরা, we had never anticipated that এই লেভেলে এই রকম ধরনের হবে. I don't think our previous generation or whatever hundreds of generation before that had also gone through this or not. Luckily, we have this system of communications, which is very nice. But before I start on how an orthopedic surgeon will tackle what he is going to do professionally and how to get along with this COVID-19 world which we have faced and which we have to face for quite some time now. It is not going to go away, and we have to live and face this and go along with our work. But before I start, let me again give you one piece of news. As you are well aware, one of our orthopedic surgeons, Dr. Shishir Mondol, is being suffering from the coronavirus. He has been admitted into Amri Hospital, where last night at 2 o'clock he has been put on a ventilator. His current situation is that he is on a ventilator. Everything is going on, but our thoughts and prayers are together with him. Shishidda is senior to me by about 4 or 5 years. I think he's a year senior to even Pratushda, but we had spent quite some time with him, and at this current moment, he is on a ventilator in Amri. How he contracted the infection, we don't really know, because we hear that he has was going to his chambers, and he had operated on 1 or 2 cases before, about a couple of weeks ago or 3 weeks ago. No, don't know the exact date, but at the current moment, that is the situation. So with this very somber note, in which we are getting our orthopedic surgeon in this position, this is where I have to invite Sharnendu Samanto to go away or to come and tell us how to go along with this COVID-19 and listen to it. Please answer through your YouTube link. Please put questions on your YouTube link, and we will try and answer it as much as we can to our knowledge. And you must realize that our knowledge is incomplete. What we have gathered, it is not through experience, but through reading and discussing. No one has any experience of how to go along with it. But without ado, I think I'll tell Sharnendu to get ahead with how to go along with COVID-19. What's right, what's wrong.
Thank you, Indroda. This is an endeavor from all our colleagues from West Bengal Orthopedic Association and the AOTS, the Trauma Society of the West Bengal. And we are supposed to talk on the how to go along with COVID-19. As you can see from your screen, I have written one side on the left side of your screen is the coronavirus. Why it is known as the corona? Because it has gone the crowns. And it started from, if you go to the right side of your screen, it started from the wet market of China, is a small province, Wuhan. And then it has gone to all the corners of the world and to make it a pandemic. Okay, so in between these two pictures, I have written like 2019 BC. What is the meaning of BC? The meaning is BC is like before Corona. So life was different in 2019 BC. And what's right, what's wrong? Because a lot many things are coming through the Facebook, Twitter, Instagram, and your newspaper. Lot many papers. Even if you hit in your TV, if you go to your whatever, wherever you hit, is the only news is the Corona. So you are already been studying the how to, because we left our microbiome thing in the probably the 4th year of our MBBS career. But still again, now we are reviving with so many knowledge to the social media. Like Corona, we know there is a RNA virus. So being orthopedic surgeon, I always tell whenever I go to the meetings throughout the country or abroad, I tell the orthopedic surgeons are really not intelligent, they are clever. Okay, so what's right, what's wrong? And I have written my name before that. It is 2020 and WC. That is now at present point of time, we are living, probably struggling at 2020 WC. That means with Corona. And when we finish this meeting, probably we will be heading towards the AC. That means after Corona. So 2019 is BC. At present, we are in lockdown position in WC like with Corona. And after that, probably when we come out of the lockdown, we'll be entering in a new era, 2020 AC. So there are few guidelines being laid over by the parent body, Indian Orthopedic Association. They are our beloved president, our secretary, our vice president, president-elect, and the full scientific team. They have organized some protocol how we should go, the all orthopedic surgeon throughout the country. And probably during this meeting, when I presented this talk first in the Shoulder Society, or Shoulder and Elbow Society of India last week, that time Peter Brown, who is from Liverpool, he was there in the meeting. Also Raman Kant, he is also from UK, he was in the meeting. So we discussed about what we are going to follow in Indian orthopedic scenario and also in the British Orthopedic Association. We had the joint meeting with the British Orthopedic Association along with some members of this Indian continent. So what should be the guidelines? Because you see, whenever we go through our rule books, even from our childhood, we are never fond of going through the rule books because this is too boring to read. But whenever you are trouble, wherever you face any litigation, that time you have to go to the rule book. Otherwise, nobody can save you because world is very small and everybody will be pressing that you have not followed the rule book. So every time we are in trouble, we have to go to the rule book. So this is the disclaimer. If you go to the last paragraph of the disclaimer, to the fullest extent of law, neither Indian Orthopedic Association or the contributors of this guideline assume any liability for any injury and or damage to the person or persons or property as a matter of negligence or otherwise from any method described in the material herein. So you have to follow every step meticulously. Otherwise, probably you are going to risk yourself. You are not going to provide the best care for the patients who are going to suffer. And probably at the end of the story, you will be risking your own family. So they are completely relying on, because you are coming with the virus to your home. So whenever I go, whenever I in my day-to-day life, whenever I am struggling, so how to go right, I refer to the person, because I believe this man is probably the one of the greatest fighter ever lived in the earth. So I will request whoever is seeing in the YouTube post, if you can guess who is that man is, you can send your answer. Then at the end of the lecture, I will tell you who is that guy. Because every time in trouble, I worship this man. So why the guidelines? Because this is absolutely, we are in uncertain scenario. Yeah, our practice, how to go with the OPD even, we are uncertain. We have to think of our safety, personal safety. It is not the question of ourselves. We are not that selfish. We think about the patients, we think about the group, the guy, the sevika, the nurses, the staffs who are assisting me in the OPD, in the clinic, in the OT. I have to, because I am the leader there. I am the person who is supposed to take care of the whole team. And overall, which is most important, is the patient care, because we are all dedicated for the patient care only. So why to follow the guidelines? Because you have to follow your personal protection, how to go with the conservative treatment. When you are supposed to do operation, even sometimes you have to refuse some operation, and remote consultation, like whether to go, you can give some opinion in the WhatsApp. Even if there was a legal notice before the corona that you cannot do, if you cannot give any sort of opinion in the WhatsApp, you cannot do even some doctors were punished for giving some opinion in the WhatsApp. But with this, with corona, WD 2020 WC, even there is recommendation that you can see the x-ray, you can talk to the patient over phone, you can go with the telemedicine, so that you have to have the remote consultation, so that you can reduce the burden in the your OPD clinic. And lastly, you are the team leader, you have to take care of your staff well-being. So as we all know, there are 3 levels in the hospital, in the big corporate hospital. Probably you cannot follow in the smaller setup. Like level 1 is your OPD or the triage. Level 2 is your emergency departments, your clinics and ICUs there. And level 3 is your operation theaters, where you are probably going to treat the suspected or the confirmed cases. So you all know there are some fuzzy things in the WhatsApp, in the social media, what is the best mask, 95 or the normal mask what we day-to-day use. Why it is named like 95? N95 is the mask which can filter 95% of the coronavirus aerosols. Because if you see in the slide, the corona particle is 100 nanometer. So if the pores in the N95 is around 300, then how you can tell me how it is going to filter 95? Only because there is a flow in the air, and the corona particles flow in the air in like the Brownian motion. So it can be filtered 95% by your N95 mask. So you all know from, because you have to minimize the aerosol spread. So 6 feet, the social distancing there. Surgical masks are recommended during all clinical encounters, even with the asymptomatic patient. That means you have to put your mask even in your OPD clinic, wherever you are roaming around in the hospital. Surgical masks are recommended for personal working in the areas where air exchange is less than 3 hours. But if you are extending for your work for like 6-7 hours, then you have to use the N95. N95 masks and PPE, the personal protection equipment, recommended for medium and high risk clinical encounters, like your triage, emergency department, like that, and the ICU. And eye protection, listen to that, eye protection is mandatory for all clinical encounters. So how you go with the operating theater? Minimize personnel entering the operation theater. Ideally have a negative pressure. This is not possible. Have to have some buffer zone and the clear zone. Please put on the PPE on the buffer zone and dispose it in the buffer zone only, because it is not been recycled. Patients should have surgical masks and caps. Please remember this. In the smaller cities, smaller setup, probably we are not going to follow, but even the patients, those who are asymptomatic, they can generate aerosol in the OT and we can all be infected. We all know how to go around with the donning. Donning means how you go ahead, how you put on your things. So this is the start area. So put on your surgical dress over there. Then again, you put on your sterilizer in the hand, wash your hand, put on the cap, disposables, your mask, then put on the single layer gloves, then put up the PPE, then finally this one, your main second layer gloves. Then doffing. This has to be done in your buffer zone, because it will sequentially go ahead. But every time you see in this picture, once you remove one part, you have to again wash your hand, because now the fomites are there on your gown, your gloves, or whatever you are doing that. So it is a teamwork. And also remember that you are the leader. You have to take care of your whole team, so that they mentally they are not been stressed out, because in this lockdown period, wherever we are going, because human being, we are all social animals. If we can't hug somebody, if you can handshake, if we can smile, if you can mix If we can gossip, then we are mentally we're struggling. If so, we are all mentally based struggle. So we have to have the mental health even. So what are the guidelines in IOA guidelines? Like you have to have the triage and deliver healthcare and protect the workforce. This is very, very important. You have to protect your workforce, maintain emergency surgery capabilities, protect and preserve the workforce, fulfill alternate surgical roles, and fulfill alternate non-surgical role even. Sometimes the ED guys are totally been, or the ICU guys, they are completely been overburdened. That time you don't say, okay, I am not orthopedic surgeon, I don't know anything. But that time also you have to fulfill the non-surgical roles. So recommendation, this is a big slide. I'm not going to every detail. This is like COVID positive, COVID-19. I tell you the point that even the patient is tested COVID negative, please, please, and please take that at the COVID positive patient. So you have to take all your precautions that you take during your COVID positive patient. So this is the way how you use, this is not every time. Normally we don't use the balaclava sort of cap, but this is there because only you have to, because all your virus which is coming in the aerosol, this is going to stick in your, even the neck. People are telling, even in the evidence, that if you don't have the balaclava sort of that thing, then you use that thyroid guard, thyroid shield, what you use during that your CM thing, so that your neck is covered, so that no part of your body is exposed during the OT, because we are going to use the drills and the reamers. Main recommendation, do not use the laminar flow. This is a gray area, because this was the primary recommendation was there in the guideline, that you don't use the laminar flow, because if you use the laminar flow and the AC, there are a lot of aerosol will be roaming around in your OT in the positive pressure. So now today also I talked to Peter Brown in Liverpool, and I had sent to Orpit Jariwala, who is a very close friend of mine, who is in Gandhi. He told, okay, there is no clear evidence. They are utilizing the laminar flow. But if you use the laminar flow, you are working in your positive pressure. So try to reduce the electrocautery, because during the electrocautery, there is lot of aerosol. So whenever you are try to use it as minimal as possible, or else if you are trying to cauterize the vessel, then use the sucker immediately at that time, so that you can suck the smoke, so that aerosol is less. Do not use spacesuit. Do not, because they will be reeling inside the spacesuit. Do not use pulse lavage. Please don't use the pulse lavage. We don't recommend the pulse lavage even the compound wounds. Use suction, as I told you, suction during the electrocautery. Use absorbable sutures. Please try to use the absorbable sutures in the closure. Try to use the steady strip sort of scenario, so that you know that you tell the patient and the relatives that there might be some sort of serous discharge or inflammation, but you don't have to remove the stitches, because that way you can reduce your follow-ups in the clinics. Okay. Use clear dressing, so that from the distance you can see there is a soakage or not. You don't have to change the soakage, because if you use a big dressing, you have to remove the dressing, you have to tell the patient to come to the OPD, then again there is to and fro motion inside the OPD. Use back slabs. Remember, use back slabs or splints. Don't use full
Your sound has gone.
cast, because if you are using the full cast, you have to check, you have to talk to the patient whether there is some
Your
compression or not,
sound is not
whether the blister is there. Again, for the removal of the cast, again you have to cast, you have to tell that this thing, your cast, for the cast you have to, so maintain emergency capability. Is it clear now?
Yeah.
It's
Sir,
clear?
I think you repeat the last
It's
talk, because the sound was not clear.
now
So just repeat.
The last slide, this slide, you repeat again. This slide, maintain emergency surgery, go at it again. Sound was not clear.
now it is coming clear. Now it is coming clear.
Yes, now it's clear.
Live, otherwise it is difficult to communicate.
Yes, sir. It is live. You can go ahead.
Okay. So use the suction with your cautery. Use your suction with the cautery, because your video should be there, so that from the hand signal I can know everything. Okay. So use the suction with the cautery, because there is a lot of smoke during the electrocautery, and that's why problem is that lot of aerosol generation is there. Use absorbable sutures and tell the patient and party that every time you have to come to this.
Sound has gone off again. Shandendu, your picture is frozen, your sound has gone off.
I think his connection is lost, sir.
Connection is lost. Hmm.
Yeah,
He is coming again.
it's coming again, right. Shandendu, say something.
His internet was, I think.
Ah,
Sir, can you hear us?
Yeah, you have muted me from your side.
No, you are unmuted, but
You're
your
unmuted.
internet, I think it's not stable enough. Something problem was going. You can go ahead now. No problem.
Your slide is there, no?
No, you
Not,
share screen again.
you have to start the screen share again.
Is the slide there?
No.
No, you have to start the screen share again. You have to stop and start it again. You stop and start again, sir.
Okay, no problem. Just stop sale for a second. Share.
Yes, it's coming.
It is there?
Yes.
From which slide it is there?
No slide, it's your desktop which is coming.
Okay.
Yes. Go to the slide. You
Now
have
it is there?
Yeah.
Perfect.
Yes.
Yeah, go ahead.
Okay, so so sorry for the internet, because it is a lot many people are in the Zoom, and what every time it is in the YouTube, a lot many people are just log in. So it is probably that because that is the way. So sorry for that. So whenever using electrocautery, make it as minimal as possible, because during the electrocautery, the smoke is going to generate a lot of aerosol. So try to use your socket tip at the where you are burning it. Use absorbable sutures and tell the patient and party that because of the absorbable sutures might be some sort of inflammation or serous thing might be at the suture line, but don't be worried, because you don't have to remove the stitches. So that is the way you can reduce your follow-ups. And use clear dressing, like your you can use the steri drape or the IO-band sort of thing, so that you from the distance you can see the dressing. And use back slabs and splints like knee braces, so that you don't use the full cast, because if you use the full cast, you have to see whether the toes are moving, fingers are moving or not, whether swelling is there, patient might be having some compression, and your blisters, and you have to, for the removal also, he has to or she has to come to the OPD. So maintain emergency surgery capabilities. I will come onto that. Protect and preserve the surgical workforce, because you are work in a team. So you have to have the full team. The thing is that full team is not been exposed to the corona. So fulfill the alternate surgical roles. What is that? Due to the pressure on the emergency department and the non-respiratory emergencies may be triaged to an alternate pathway, which may need support from the surgeons. So you cannot tell, I am surgeon, I am not going to treat, or I am not going to go for the triage. Even the MCI has given the directive to all the states, please give me the registered doctor list for every state who are registered in the MCI list. So you might be called for if there is emergency, because when the bell curve will reach, and we are still at the up climbing part of the bell curve, we are not at the top. When we will reach the bell curve top, probably all will be needed at the top of your bell curve. And outpatient management, probably people are, I think many people are telling that probably those who are doing in the periphery, why doctors are not doing the chamber. Because remember, even we go to the normal clinic or chamber, lot many people are just sitting in the waiting area, you cannot maintain the social distance. The recommendation is that for one patient, only one attendant will come. You know that in orthopedic guys, people are who is crippled by your leg fracture or the hand fracture, two people has to hold. And who is coming as a patient, he has to has the mask on. Please remember, he has to has the mask on. The guy who is accompanying, only one guy is recommended, he has to have the mask on. And please try to sit at a distance. Try to remember that even at the room, don't examine like thoroughly every time what you are used to do. because that way you can maintain. Only do pertinent examination only, unless and otherwise you feel that he has to be touched, you have to go for very important few clinical tests, then only you go with the clinical test. And every time you see the patient, you have to remove you have to clean that area with your alcohol based solution. You have to clean the chairs, clean the handle of your door. So this is not possible in small setups, but this is the recommendation. Otherwise, the whole team will be infected. So remember, this is also very point, that remember that radiology people are all been overburdened. Don't try to go for every check X-ray and CT scan, because if you send your guys over there, the radiology guys, every time the patient is lying on the table for the X-ray or the CT scan, they are going to be infected. The recommendation is that for every X-ray and every CT scan, you have to wipe the surface, because we are struggling with the fomites. Routine follow-up, try to reduce as minimal, please remember, as minimal as possible, because if you remember that if you can reduce your routine follow-up, probably you can curtail for 50% of your the people coming to your OP or your clinics. So management of specific injuries, this is the typically the rule book for the orthopedic guys. Dislocation which are reducible, please try to sedate, give some short anesthesia, try to reduce in the OPD or in the emergency sort of scenario. Don't admit, don't take the patient to OT. Most upper limb fracture can be treated or splinted for some time. Don't try to go with the emergency operation. It can be delayed. Even with the non-union, malunion can be taken later, but don't force them for the OT. Ligamentous injuries of the knees. Ligamentous injuries of the knee can be delayed. Unless it is a multi-ligament with neurovascular, don't embark on treating on them. Penetrated injuries, small stabs can be disposed from the emergency department. Small abscesses can be drained. It can be discharged to daycare basis. So this is a busy slide. I'm not don't want to make you perplexed. But remember, this is the green part is the COVID negative patient. Plus remember, even this don't follow the flow chart. Even your COVID-19 patient might be asymptomatic carriers. So COVID-19 negative patients, those who are taking to the OT, please take it at the red guys on the left side. It has to be, all the protection should be taken in like the COVID plus positive patient. If you are not able to do, because there is no free license to do the COVID test everywhere. So if you are not having the kit, even for the rapid test, please remember, I am going to give you 3 important points. Do the CRP, do the full blown LFT. And if you have the facility, please do with not only the chest X-ray, it is do the CT scan of the chest, because by the CT scan of the chest, you can detect the peripheral thing, peripheral consolidation, peripheral lung changes. By that way, you can diagnose probably this guy might be COVID positive, even he is negative, or you don't have the facility to do it. So please don't look at this slide. I request, please don't look at the slide, because this is a rule book slide. This is a very busy slide. But if I will upload this slide. This will be uploaded in the YouTube. Every time you are in trouble, you can go and hit the YouTube. You will get this slide. The red part, which is on the left, this is the recommended area where you should do. This is the absolute indication, like your open fractures, polytrauma with neurovascular injuries, irreducible fracture dislocations, compartment syndrome, crash injuries, septic arthritis, acute osteomyelitis, and amputation with gangrene. This is the part, this is absolute. All other are relative. If you go to your yellow column, you see your femur fractures, your shaft femur, your distal femur. These are all relative. So that you don't feel that shaft femur is a real big emergency you go up to. This is relative. Okay. Non-operative management, like your stable tibia shaft fracture, clavicle fractures. This is the lighter green one. The stable upper limb injuries. These are all the column wise. It is given in the IOA guideline. You have to follow the guideline. Please listen to it. Not all the fractures, as we all do, because if you take the femur fracture, you have to ream. You are going to generate aerosol. Again in the spine, remember the red slide. Unless this is a cauda equina syndrome, even if you see the yellow channel, unstable spinal fracture with neural deficit, it is not in absolute indication. So now you can understand how much we are flexible, how much we are determined, that we are not going to treat all the spinal fracture without neuro deficit. We are going to fix it. Only the cauda equina, epidural abscess, see that epidural abscess, discitis, pyogenic origin, spine fracture which is unstable, paraplegia, then only you are going to operate. In the plasty, only the PGI, periprosthetic infection, and the periprosthetic fractures. These are your absolute indication. Then what is in the onco? Not all the onco. Infection including the infected joints in the sports, multi-legs with neurovascular, not the multi-legs without neurovascular. So the yellow and the green column is big no for all the orthopedic surgeons. This is the device this is for the by all the surgeons. This is not very haywire thing. This is, if you see, or no, my pointer is coming on the screen. No, there.
Yes,
Pointer.
yes, coming.
So this part where I am circling my pointer, this part of this glass thing is open. This thing is coming from the backside. The backside is closed. So this when I did the Shoulder Elbow Society meeting with Peter Brown from Liverpool and your Ramakant, who is also from UK. So all the guys, they were from the BOA. We are joint meeting, and this person who is the Bala Venkat is a renowned anesthetist in our one of the mentors of Indian Orthopedic Association, Rajsekharan's hospital, the Ganga Hospital. He has devised this. This is the one negative, because you know, during your intubation or extubation, lot of aerosol is coming. This is a burst. This is probably the most important part to remember, that during the extubation and intubation, the burst of aerosol is coming. So please, I request all my junior friends, my seniors, when the anesthesia guys are doing the intubation and extubation, as because it is not possible in the negative pressure area, please don't loiter inside the OT. Let the anesthesia guys with full PPE, N95 mask, they do the intubation and extubation. But this is a small device they have devised. There are 3 hand entry, so that these two, this V-shaded thing, the entry for the anesthesia guys who will holding the laryngoscope and the intubate through these 2, and which is on the left side, one hand is coming. This is for the assistant who will hold the trachea to stabilize. Can you understand? So if I go to the next picture, probably we understand that he is coming from the back side. This is the anesthetist. This is the patient. My left side, the down part of my screen is the leg side of the patient. The gloved part is the head side. So with the gloved, he is putting his hand through this. If you can see again this back side, he is putting, the anesthetist is giving his hand from there and there, from this and this. The assistant is giving his stabilizing the trachea from this side. So I will request all my surgeons, you can take the picture from the screen, so that you can tell your anesthetist, this is a very you can do it at a jugaad sort of thing. So we can do it, but during the intubation and extubation, our anesthesia friends will be protected. So this has been devised by Bala Venkat, who is in Ganga Hospital, Rajsekharan's hospital. And he has sent this picture today only, and I have taken his permission. So I told him that I am going to give one lecture on the COVID scenario for orthopedic. So he has sent the picture just now.
Just to interrupt, Shanendu, on the previous picture, can you just go back?
Yes, I can go back.
Yeah. You see, is he wearing a face shield, or is that mask the one that is to be used? It has to be a N95.
Yeah, the thing is that during the anesthesia, you are supposed to put on 2 masks. One is the face N95 is below this mark. This part is the black one. This part is not been open. Below that is the N95. So anesthesia recommended to put on 2 masks, one N95, over that your surgical mask, and the upper part of the mask should be taped. Remember, the upper part of the mask should be taped with a micropore, as we do, because when we started doing, because my specs is the new one. So when I started doing using the spec during my OT, lot of fogging was there. So if you can use the tape so that nothing is, your aerosol is coming through that, and even that there is no entry from the top. I think, Indra, I cleared you.
Yes, so 2 masks, that's what I was saying.
2 masks. So,
the N95, on top of that, the surgical mask, which
yes,
is
for the surgeons even, I will tell you, those who are going to operate, which is emergency, I in my hospital use your clear through face, as I told during the balaclava, you can use that the face shield so that there is not a splash on your back, because of the splash it can come around. Okay. So inpatient management, the major trauma, multiple injuries, those who are really fall in the category of the red column, then only you'll take, and try to make the as little as possible stay inside the hospital. Yesterday, I operated one acetabular fracture. It was completely central fracture for a doctor. He was going to market, he fall from the bike, but I was forced to do that. So this is the fracture where you can do. So surgeon has to take the base decision, because only the vascular injury, please try to, even for the vascular injury, they are recommending don't go for too many investigations. If you feel that the knee is not going to survive, go for the amputation. Counsel the patient, the patient don't go for the reimplantation. Even in this COVID scenario, you are jolly, you are be licensed that you can go with the amputation, even there is a doubt. Hip and femoral fractures are not, remains urgent, but it falls in the category of the yellow column. Complex fractures should be planned properly, and try to do as many as possible the daycare procedures. The upper limb fractures, as I told you, can be splinted, can be delayed. Wrist fractures, all splinted, delayed. Consider non-op treatment as maximum as possible. Non-unions of the upper limb can be treated. Malunion of the upper limb, the lower limb can be treated later. Lot many treatment are there. Once the lockdown, once the corona will settle down, one will enter into the AC after corona, then tell the patient in the AC are going to treat you. Cauda-equine, I told you. Septic arthritis, I told you. Pediatric fractures, don't jump on. Splint, go for a slab. Just go, don't go for the sort of what the fractures don't have to operate, don't go for that. All major elective orthopedic and spinal surgery can be deferred.
Just a question, yeah. The ones that you're deferring, how long? We have no idea when everything is open.
Yes.
Elective, operative, and spinal surgery. We are being swamped by questions. When will you do the operation, etc.?
Yes, I will come to the questions. I think once I finish the talk, we are, because we have got the paid channel for this, because Arnav, me, and the man behind Ritik. So the Arnav and Ritik, we have all paid channel for that. So we don't have the time limit. We can go with the YouTube. There is no problem. We will solve every question for, because if whatever we are telling from Kolkata, that doesn't suit for the rural setup in the urban areas. So we have to mind that all the people, those our friends that seniors are working in the rural or the suburb areas, we have to satisfy their questions.
Yes.
So I told you at the beginning of my talk, because I worship this man. Because whenever I am in trouble, I told you that picture in the third slide, that you can answer that guy, who is that person whom I worship. This is the person who was locked down, believe me, for 27 years. He was locked down in one cell for 27 years. So he was not depressed. So we are being locked down for hardly for 6 weeks, 2 months. So don't get depressed. We are mentally quite strong. If he can, nobody could succumb him. So if he can survive for 27 years, 27 days is nothing for us. So this is the person I worship. So this is one of the greatest quotes by that man. As I walked out the door toward the gate that would lead to my freedom, I knew if I didn't leave my bitterness and hatred behind. Remember, if I don't stray or don't pull off my hatred and bitterness behind, I still be in the prison. So you have to be very, very mentally strong, because if you are always been thinking that I am in lockdown, you'll be in struggle. So this is the last slide. Those who can read Hindi, that in Hindi, when the last call for us, even at the beginning of the talk, I respect Indra, because he is one of the mentor in West Bengal scenario throughout the country. So Indra told that one of my senior Dada is suffering. He is we put on ventilator last day because he was operated, one guy, probably from there he might be infected. So when the last call, इसमें लिखा है, चलो डॉक्टर साहब, लिखा है, when the last call for us will be there from the God, इसमें doctor is telling, बस और एक मरीज देख लो. But this is the way we have taken the Hippocratic oath. Even when the last call will come, still we'll tell God, just wait for 5 seconds. This is the last patient I am seeing. I have to do my job. So medics, remember, medics are different breed. We are made of a different nerve. It is made of steel. We are born to win. Believe that we are born to win. Nobody can beat us. Even this small particle like corona, which is invisible. Visible could not beat us. Even the invisible corona cannot beat us. So a winner is a dreamer who never gives up. So you have to dream, you have to struggle because we are man of steel. So this is the last slide. We have to take care of the whole world. We love you. We love our world, Mother Nature. Namaskar. Take care. Stay safe. Thank you.
It's an excellent, inspiring talk by Sharnendu. Lots of things is to there. I'm sure there'll be many questions. You can please it. Abhishek has said hats off, and don't have a hat, but if I had one, I'd take it off, Sharnendu. Excellent. Can we have the questions, please? There's one from Dinesh Patel. If you defer the operation, what is the option medico-legally? If you defer an operation, is there a medico-legal problem there?
Thing is that I told you that if you are taking the patient inside the OT, you have to follow the 3 slides probably in the YouTube that probably is there. Even if you can request me or Arnob or Indroda or Ritik, you can give I can give you the whole PowerPoint to you so that you can have the red column, you can have the yellow column and also the green column. So whenever you defer the patient, because yesterday I deferred one rotator cuff surgery, that lady was suffering from pain. She was just forcing me, I will be getting admitted today. So the counseling part is important. You write there that no fracture is going to be that problematic. So you can defer, probably 3rd of May or 15th of May will be going out of the lockdown. So the fractures which are not been in the red column, you can defer that. But write that because documentation is the key.
Okay, here's one question from Abhishek Dash. What's wrong with pulse lavage?
Yes, because when you use the pulse lavage, because of the pulse lavage, there will be a lot of aerosol generation. That's why I told you that electrocautery you have to use with the sucker. Pulse lavage is big no because of the aerosol generation.
Okay. So since I know questions are coming, but before they say, sure, one more question to you. Should we use N95 in the OPD?
Yes, because you are not seeing one patient. Because you are not seeing one patient. You are supposed to be there in the OPD for suppose 1 hour, 2 hours. You don't know who is positive or negative. So the patient party, single guy who is coming, he might be using one single mask, the surgical mask, or even with the whatever mask is available. But the doctor and the guys who are roaming around for 2-3 hours in the OPD, he has to use the N95.
Okay, comment from Rajesh Moore. Lockdown is going to close, but not Corona. That's perfectly right, Rajesh. We have to live with Corona.
Yes, that's why I told you it is after Corona, 2020 AC.
Santosh Kumar, not using laminar flow will mean not using AC at several setups because it's integrated.
Because the problem with the laminar flow, the most of the setup in India or the big setup where we work is the laminar flow and the AC are both coming in the same bend. So it can even if you have to go to the engineering department of your hospital so that you know it is not going to be vented in other way, because in the ward if it is connected it can infect. So that's the way, that is why the recommendation is that you don't use the laminar flow and because it is connected with the AC vent. But the recommender, because today I text Peter Brown and also I text Arpit, who is in Dundee, who is the chief now. So they told that they are using the laminar flow, but there is no evidence. He will be giving me the evidence. But if it is not connected and vented to the other wards, or you can use that. But laminar flow, remember, it is a positive pressure. If you use in the positive pressure, your aerosol will be much more.
Rajesh Moore, how long to wait for operations?
Because that will depend upon the fracture to fracture. Suppose there is a femur fracture, you can wait for 2 weeks, no problem. Suppose there is a fracture neck femur, suppose he was supposed to, suppose 70-year guy who is supposed to go for a bipolar, so you can wait for a month. So fracture to fracture, if you can delay, you can delay.
is this a decision to be taken by the surgeon alone, or is it going to come from the governmental sector?
No, it has to be the surgeon alone, because this is the guideline given by the Indian Orthopedic Association, and this guideline I'm referring you. It is not only the guideline of the Indian Orthopedic Association. I have read through the articles of the not only the BOA, the British Orthopedic Association. I have also read the recommendations of the American AOS, the American Association of Orthopedic Surgeons. So I am going. Not only this lecture is just been following the Indian Orthopedic Association. It is mix and match with the BOA and also the AOS.
So it is basically the surgeon who will take the decision when to operate.
Yes, obviously, because if it is not in the red column, don't just jump on, because you will be risking not only you, your family, and the whole. Because if your OT is infected, then thing is that you have to shut the OT for 14 days. Your
Correct.
whole staff will be go to the quarantine for 14 days. Who nobody know in this, your second team, unit 2 and unit 3 is not going to come to the OT, because we have got the same OT, single OT complex.
Sutonu's question: patients with acute fracture with fever, which department should see first?
So I fall into the trap of Sutanu. So fever fast, obviously, you have to have the fever fast.
I will agree with you.
If you go with the fever, because any fever is you take like in this with corona is a corona plus, unless and otherwise proved. So for this fever guys, if you take this guy for treatment, do one CRP routine test. I mean, if you leave aside all the tests, CRP, LFT full blown, CT chest. If you are not been able to do your corona rapid test, because our hospital has got the license to do the corona test, the rapid test. But if in every hospital, if it is not there, in the rural or the peripheral setup, suburbs, if you are not doing, you have to have these three things.
By the rapid test, you mean the antibody test?
Yes, rapid test which has been done, because you cannot go with the ELISA every time. Because if you go with the ELISA test, you have to go with it will take some time, and you cannot go with the full blown like either in mass numbers.
No, but the problem is the antibody test does not give you an interpretation that the patient is absolutely negative.
Yes.
It will just give you an indication that he may be positive. Now, if he is positive, you have to go for the PCR.
So that's why I tell you that I respect you that. So because you remember, if you go with a rapid test, the false negative, remember this client, the false negative is 30%. False negative is 30%. So 1/3, 1 in 3 will be false negative. That's why when I showed you the green column of the corona patient, red column of the corona patient, I told you that this is a busy slide, but even if this falls into the green channel, still you take that in the red channel, only because 1 in 3 will escape through your rapid test.
So this is not a question about the false negatives.
Yes.
If you do a rapid antibody test, it is either positive, which indicates that the patient has had infection.
Yes.
And if it is negative, he does not have that infection yet.
Yes.
Provided it is done after 8 to 9 days of his being infected.
Infected, yes, because
so if you do a rapid test, it does not mean that he is corona negative.
Yes.
Even if the antibody is negative.
Yes, that's why it is.
In that case, do you recommend?
False negative is there.
Do we recommend always, especially for elective operations? In the emergency, there is no question. The only thing you can do is the antibody one, and pray and hope and take all precautions and do. But yes, in the elective cases, do you think it is mandatory that the PCR test should be done before they are operated?
Yes, this is mandatory, but this facility is not there. This is mandatory. This is recommended. This is mandatory. I repeat, this is recommended and mandatory.
No, there are 7 government hospitals now in West Bengal and 6 private labs, which are now doing with a possibility of increasing more. Yes. Now, in the elective cases, do we wait for them to get this test along with whatever tests we do normally preoperatively?
Yes, you have to wait for some time, because elective cases, unless there's a dire emergency with neurovascular or the guy is bleeding, then probably you can risk your life or risk yourself.
Yes, because I had
otherwise, if you are doing a neck femur fracture, you want to fix it after 1 day or 2 days, it is mandatory to have the test on.
Yes. So I had a talk with a couple of anesthetists, senior ones, and they were also of the opinion that in elective cases, you should have a PCR test done to rule negative. And now they're probably doing a rapid PCR also. So let's see what comes about. Now at the present moment, we can do a PCR in these 13 laboratories that are available in our state.
Yes, that is known as the rapid. It is not rapid test. This is known as the reverse transcripted PCR.
Yeah.
Reverse transcripted PCR is the recommended one.
Yes, but that is not yet available.
Yes.
Devojyoti Bappada is saying, is our staff in OPD to wear N95 masks?
Bappada, this meeting is for you. So you told me that Swarnendu, please organize one meeting so that we can fix some problems. So if in the OPD, Bappada, and I'm telling to everybody in the OPD, the guys who are all been there for more than 3 hours. So I told you during my lecture that you have to use the N95 along with the cap, mask, and also if you are in the going to the OPD, I forgot to mention one point. Try to remove your this shirt and pant that you are going to the your hospital. Remove that. Go with a whatever you wear during the normal shirt or the pant for your OT. Remove your shoes. Then try to put on the gown, your cotton gown on that, so that your whole forearm is covered. Don't use the half shirt because the fomite can streak in your neck, which is exposed. The half shirt, your full forearm is exposed. Your foot should be covered with your socks. So every part has to be covered.
The question from Shoykot, how many days a single N95 can be used? Only single use or multiple use?
Shoykot means Shoykot Ghosh, দেখো তো
Shoykot Sarkar.
Shoykot, আচ্ছা না আমার Shoykot Ghosh আরেকজন আছে তো তাই জিজ্ঞেস করছি। Shoykot, I think the N95 should not be recycled. The people are telling you can use that because we don't have the facility to do it with ultraviolet and this way. But you can recycle this. You can do the recycle after 4 days. People are telling the ideal way to have the 3-4 masks. So if you send one for the recycle and the 4th day it will come. So 1, then 4th, then 2nd, 3rd, 4th. So this way you can recycle. So you have to have 3 or 4 to recycle it. We don't have that. So we are wearing that way. But if you wear that, you have to have the another one mask with your tape on.
Another pointer over here. No one has asked the question. I'm just asking it. All N95 reportedly N95 masks are not N95. There are many in the market now. You have to be very clear about taking a reputable one. There are many N95 cheap masks which are coming out, which is not 95% virus protected.
The thing is that I told you that if you go to your search in the net, or if you read this thing, even all the European companies, the big, I am referring to Italy and all the other, France, they have just returned the PPE kit and the N95 mask from where the corona was spread. I am not naming it, but remember that if the quality is not met, who is going to judge the quality of the N95 and the PPE? Only the government guys, only the guys who are supposed to check it. Then, because if it is stamped like N95, we believe like N95. So it is not like that. So I will request that even with the N95, put on the surgical mask along with the tape on, so that you know that at least something is there.
A question from Ortho Raja. He says, can authority force resident doctors to work without proper safety precautions? If the SR refuse to work, will there be legal action taken against him?
Yes, the question.
This is a very pertinent question, because from what I hear, there are many of the junior doctors who have been told, as you said, to work in the isolation ward or in the other words, orthopedic part, the orthopedic RMOs, etc. And that is the question. If they refuse to go there, they are being told that you would have to be reported to the medical council, etc., etc. Now, can authority force resident doctors to work without proper safety precautions?
Nobody can force. I tell you, nobody can force you unless and otherwise you have the proper protective gears. Yes. But thing is that, remember, just I am telling you, this is a very, very important point. When you go to the ward, remember, this is a very, very important point. When you go to the general ward, not in the OT, the chance of getting infected is 70%. So in the ward, don't take it lightly. You have to put on the cap, you have to put on the mask in N95, you have to put on the OT dress, the cotton gown, and you have to have the socks and the gloves. Then only you go. and try to, after the everything, so suppose if you are not using the gloves every time, you have to go with the alcohol based sterilizer. So this is the way. Don't touch your face, don't touch your mouth, don't touch your eyes, because it is not through the blood contamination. It goes to the eyes, goes to the nose and the mouth.
Will the standard spectacles, we all are using spectacles, the
Oh,
standard
I forgot to tell the actual crux of the story. No guy can force you unless you get this. Unless you get this. So if they tell I am forcing you, tell them you just write an official letter and email to me. Then I will answer you in the email. So you know that you have got one documentation that they are forcing you, and you can write to the WBA office. We'll see that nobody can force you, will protect you. Our president, our secretary, and the whole EC committee members. Chinmoy Desar is our president. Partho Sarkar is our secretary. I tell you, these guys are too good and too active. Whenever they reach them, they will reciprocate you.
Shutonu writes that the laminar airflow can be disjointed from with the SE. It's not difficult. We have used it. So that is response to Santosh Kumar's question.
Yes, that's why I told you that laminar flow you can go on, but it is a positive pressure. If it is dismantled from the AC, you can use it.
Rajesh Moore again, with fracture, we can't wait for uncertain period. So you have to go in. Fracture, you can't wait for, you don't wait. You take all the precautions and go in.
For a forearm fracture, you can wait for some time. For a lower limb fracture, the waiting period is different. That is up to you. And Rajesh, you are probably more experienced than me. You can judge which fracture to be wait for how much time.
Moinak Chandra, how to sterilize N95 mask?
I told you this can be sterilized by the ultraviolet.
Ultraviolet is best, but if it's not done in the if you're in a crisis, I think you can air dry it.
Air dry
it for 4 days. Keep it in.
Yes, if there is a joke in the WhatsApp you can do in the video micro oven. Am I right, Indoda?
Yes, there is.
Yeah, so that you don't follow that, because if you go into the micro oven, next time you cannot use it. You cannot use it. Okay. So this is in the lighter mode.
Bappada says, do we need PPE in OPD?
No, you don't use the PPE. I tell you, Bappada, I told you that you have to use the cap, you have to use the specs, you have to use the N95 mark with this thing and tape. You can use the full body, remove your normal shirt and pant, which you will go with the hospital, remove that with the OT inner, put the OT cotton gown and the socks on and your shoes on.
Ovijit Bandyopadhyay, Benu, I think, has said that, do you suggest it is not safe to run small own clinic in hotspot area?
It is not safe.
Not safe, right.
I tell you that before giving the appointment, try to talk to the patient, because there is no point in taking the patient who tells there is a reeling sort of scenario, smoke coming out from my ear and jingling and numbness from my back, something coming out through my erector spinae muscle. Try to tell them this smoke will go at the end of the corona. Am I right, Indoda?
Yes, I would agree. I don't think it's safe to have it in a hotspot area.
Yes.
Because, and if you are in a position in which you have to do it, there are certain areas I think there's no other way out, or something happens, then you have to have your full PPE protection for you and your staff and everything. But defer till the hotspot is changed to a green, whatever, yellow or whatever.
And when you are doing your clinic, please remember it is not like your normal corona before BC.
Yes.
The people should not loiter in the waiting area. It has to be 1:1.
In the OPD, if we can discuss this a little bit more, is that what we have done? If you have a sitting space, please keep safe distance. Three chairs, 3 seats separate. Don't get everyone in.
Yes.
One person to come in with one attendant only. The patient should all be masked, preferably capped and hand sanitized. And the other key question, which has not come in, but which will come in anytime, what are you going to do with the X-ray plates and the investigation reports? And that I have an answer. The doctor who's examining it must wear gloves, 2 gloves. One, you can use the cheaper plastic one in the out, and the bigger and the better one in the inside. You take off the outside plastic after examining all that and throw it away. I think that's the best way of dealing with it, because you'll have to see the X-rays. You'll have to see the investigation reports if they are there.
Touch as little as possible, because remember, this is coming, it is coming as a fomite or fomites.
Needshot Maji, should I keep open fracture patients admitted for dressing, or send home for dressings at home if that can be arranged? I think send home for dressings at home. You look at the wound, how much it is. If it is a small wound, nothing great. But if it's a huge wound, I'm afraid you have to keep him and arrange for the dressing. But again, make sure whether it's corona negative or not, and take all that precaution, because if he's staying there for a long time.
Once your IV antibiotic is over, send them home.
Right.
Because you have to take care of the whole team.
Yes.
You have to take care of your family, not only the patient. Okay.
And the hospital.
Yes, obviously. That's why I'm taking, you have to take care of the whole team.
Abhishek Das needs a corona guidelines in PDF. I'm sure Shanandu can provide that.
What?
Abhijit Sharvadikari, most of the conditions recommended can't be satisfied in most setups, as all of us know. So I'm still very worried about a great number of my patients. Abhijit, the only thing I can say is that you have to take all precautions for yourself. That is important. For the patients, take whatever precautions that has been recommended now. Lessen the number of patients, get only one attendant in, make sure that they are seated properly, make sure they are masked, and make sure that they have a cap, etc., and they are sanitized. That's the only thing we can do. Do we really need N95? This is Niraj Dugar. Do we really need N95 when virus filtration is same as a 3-ply, 95%?
I told you that N95 is named only because it can filter 95% of your this thing. Corona is 100 nanometer, but your pores in the N95 is 300. You can tell me how the corona is then filtered. It is because of the Brownian motion, because the air is flowing, it can filter 95% of the mask. There are N99 mask is there is they are sort of, but N95 is the only mask which is recommended for us for the surgical use.
Gaurav Chatterjee says, should COVID-19 test mandatory as PSC in our setup? If you have to do test for a patient who has some suspicion, then how to conduct that from a small private setup now? No idea.
Indudha, you can answer that. Probably you have been going to repeat that.
Yes. So you can do it. The suspicion, you have a suspicion, you can recommend it to be done. If the government sectors are in a big pressure, that can be done free of cost. But if patients are willing to pay some money, then you can do it in a private setup. You can ring them up and write your recommendations. And I think
I think every guy in the West Bengal Association, or the guys who are in the circulation, they got, which are the public setup which has got the license to do it. You can write to your colleagues in that hospital.
Yes. So is disposable surgical mask safe to seeing patient in OPD from a safe distance?
Is disposable
surgical mask?
Yes, I think probably the third time this question is come.
Yes.
That as because you are staying in the OPD for more than 3 hours, you are taking the many patients to come in one go. That's why it is safe to use the I told you, for any clinical encounter, you use the N95. Am I right in the
N95 is absolutely recommended, but the only problem is that if you don't get access to an N95, you have to see a patient. I would say that use this system of using these disposable surgical masks. Use 2 of them, but tape the top thing to your skin. Tape the top thing to your skin. You can tape the sides also, but keep it. That is the only way you can use this in a reasonably safe way and maintain safe distance.
I can give you some scientific data on that. The normal surgical mask only filters 30% of this particle, the aerosol. So that's why the N95 is recommended for surgeon. Please make yourself safe.
Rajesh Moore, should we start cold OPD after lockdown? After the lockdown is over?
I think Rajesh is completely been stressed.
Yeah, these are the problems which everyone is.
Yeah, we are all stressed. Once the lockdown is over, probably we are just waiting for that. We are going to serve the people. because we are all social animal. We cannot do without handshaking and hugging somebody.
I would say, Rajesh, to take it in another way, is that the conditions are going to be the same after lockdown as regards corona, as regards the general public, whatever infections, whoever is an asymptomatic, we wouldn't know. Lockdown or no lockdown.
I
So
tell
you
you,
have to
this is
start the whole PD, and you have to take all your precautions as we have described here and go ahead with it. Less number of patients, but I don't see any reason why you should not. I understand there's a lot of family pressure. Each one of us are facing family pressure. Don't go, don't go, don't go. And but you can't. I personally think you can't. You'll have to face it. Lockdown, not immediately after lockdown, you have to face this. Siddhartha Gupta, yes, he has an interesting question. How is a delay of 2 to 3 weeks going to help in the present scenario?
no, no, problem is that Siddharth, thing is that I told you that unless it falls in the red category, don't take the patient. If you make the delay, you are probably making less number of OTs, less number of visits, because every step counts. So that's why you have to minimize the steps. So suppose you have to go to operate on 2, but you feel that you are going to operate on 6 patients in a week, then you are making another 4 there. So please wait for some time, let the lockdown be over, and jolly well we can do it. That's why people are telling that probably when the lockdown will be over, will be all been overburdened by number of cases, because not many people are waiting for the DOTs.
Now, I think what he was meaning to say is that the same thing as we discussed with Rajesh, is that the conditions are going to be the same, what it is now and what it is 3 weeks later.
No. I tell you that this, you have to live with the corona for another. Believe me, you have to. It has been evidenced by the people, those who are writing the papers, that after corona, you have to follow the principle probably for 1.5 to 2 years. Believe me, you have to struggle. You have to follow the safe distancing, not mixing and matching, for another 1.5 to 2 years, unless the vaccine is coming in the market, or else there is a hard immunity. So then.
Yes, this is the major thing, an acceptance of what is going to come. Medicine is changing. Medicine has changed for all of us. All we have learned or lived with for all these years is changed. And we have to, get ready and get going in this change scenario. This change is not, you're not going to go back to what you were in 2019, where you're going about all over the place and doing everything. No, this is changed. So you have to adjust to that, and we have to start adjusting from now on.
So think that like
Bapada is an interesting question. I would expect it from Bapada. What is recommendations for CTEV?
Because you told us that you probably have got the maximum number is not that. You have got the maximum number of follow-ups with CTEV. But problem is that because CTEV, you cannot tell them that you don't come, because every week or every 2 weeks you have to change the plaster, you have to tell, you have to show. Even they are not with the splint and plaster, even they are with the splint, you have to show them the exercises. So CTEV guys, if you call, space them. Don't, as because you take them 20 CTEV in one go in your chamber. I know that you have got a CTEV day in your chamber, but try to space them so that no 2 guys at the same point of time. One guy, tell them to, suppose I am telling some, you come at 10, next guy will be called at 10:30. Next guy will be like, as you know that how much time, I don't know, because I know, don't treat the CTEV, I don't have the knowledge of treating CTEV.
Make the mothers also wear masks. The children fortunately are a little bit protected, but even then you have to be careful with the accompanying persons.
On a lighter note, can I tell you, Indra?
Yes.
The first operation I did in Peerless Hospital was a CTEV.
Okay, Siddhartha, your question is antibody is positive only after symptoms starts. Not exactly. A person may be asymptomatic but be antibody positive after 8 to 9 days. In the asymptomatic period, it is not negative. It is the 8-9 days. Say a person is infected, he is asymptomatic, he will test positive in the antibody test after 8 to 9 days, even if he's asymptomatic. So the whole thing is not related to asymptomatic. It's the 8 to 9 days from the infection which allows the antibody to develop and be detected. The advantage of the antibody test, as we know, the rapid antibody test results are very clear, quickly done. It's cheaper, and it can be done with a minimum laboratory backup. Santosh Kumar, and he's the one who will probably ask this. What is the recommendation for joint replacement surgeries?
Yes, Santosh, I told you there are 2 recommendations for you. I have already been done. It is only 2 indications for joint replacement surgeon. Like a big one is the PJI, joint infection, and is the periprosthetic fracture. So you be satisfied on only these 2.
In All India Institute of Medical Science,
I think that answer satisfies Santosh. Even you, Indoda.
Not quite. Abhishek Das in All India Institute, they started mandatory COVID testing in pre-anesthetic checkup. I think that's perfect. That is something which we have to do also. Reena Roy, Devapi, what about consultation in private chamber? I think Devapi, we've discussed this. You have to take all the precautions of yourself and your staff. Make sure that your patients also are, adequately masked, capped, etc., and sanitized.
And the spacing.
Is PPE advisable to in private chamber where patient comes for consultation? I think we've discussed this. The PPE part of it in the private chamber. If you can, you can. Bapada, elderly doctors with diabetes mellitus, like many of us, can do OPD with full precaution? Question mark. So
yes, Indoda, this is a gray zone sort of thing. The
yeah.
guys who are good, those guys who are more than 55, 60 with so many the comorbidities like this has been listed. You are diabetic, you have got renal problem, you are hypertensive, taking and your AC inhibitors, and your renal function is not good. Please be afraid. Please refrain from your normal. Try to reduce your exposures. Am I right, Indoda?
Absolutely. I think what I have done personally, since I fall into that category, is that I'm seeing not more than, we saw 7 patients that day with all precautions. Took 2 hours to see the 7 patients, but I was keeping an eye on the watch, 3 hours that time. So in 2 hours is over, we were out. So I think, Bapada, I agree with you there. Keep it as little as possible. Make sure that the patients are well distant. Make sure rearrange your chamber. Now that's important. Rearrange your chamber completely where the patients sit. Maintain the 6 feet distance. It is possible to do so. And all your other investigations and all that you have examined, that also the way to do it would be by using gloves. So that's it. And you have to have a support system, somebody who is also adequately dressed.
Try to finish the OPD in before 3 hours.
2 hours.
3 hours is the maximum. I told you it should be less than 3 hours.
You wait for it, but 2 hours I would really go for it. Ovijita, according to the latest Nature report, it can go through blood and fluids also, sadly.
No, this is a query. It goes with the droplets and fomites only. It is not through your serum like your HIV and the Hep things. It is not through these secretions. And people are telling you only even your gastrointestinal tract can be infected. So that's why even the paper from the recent paper from Yuhan is that you not only you have to be negative by this LIC on everything. Your stool has to be negative. So it doesn't transmit through your serum or blood, but it goes through your droplets through eye, nose, and mouth, as far my knowledge goes.
No, if there are people who are saying that, they must have their reasons. But I think, Ovijita, I think we are in a point or an area in which we have to take the probability. The probability is that we are sure that it goes through the droplets, and we have to take all precautions against it. We know it can go through the surfaces, like metal surfaces, etc., and your skin, clothes, etc. We have to take precautions against it. Doors, shoes, and all it can go in. We have to take precautions against it. But the other things we have really no control of. Really no control of, and we will wait further investigations and further recommendations to do so. Shutonu, when should we start routine OPD after lockdown ends? And if so, how long with these extreme precautions? 3 to 4 months?
Then the Indra, you answered that question.
Yeah, I think we've answered this. Shutanu, routine OPD, you take the precautions and then play it by ear. I'm sure after 3-4 months, you'll find that the lockdown effect is on and the death rates are going down, and you can loosen it gradually as to what you're doing. Rajesh Moore, I think ideal gloves is nitrile gloves. Correct, Rajesh? But nitrile gloves are not always available. If so, use nitrile gloves. Devapira, any advice regarding disposal of used mask and gloves?
Yes, it has to be disposed. As I told you, probably Devapida joined late the buffer zone, where if you are disposing this thing, this has to be disposed safely. Dispose safely, because try to use the as disposable as possible. As disposable as possible.
Akhilesh Kumar asks you, can we do OT using the HIV or hepatitis OT suits?
Yes, you can use that, because I told you we have to have the
Yes, you have to have the face guard, you have to have
face
the
guard, you have to use the face shield.
only
So
recommendation is that you use the N95 mask.
N95 along with the mask and tape, with the face shield, and your thyroid guard, you don't have the balaclava. And your foot should be covered like your HIV or hip. You take care like that for the corona. Only these are the additions for this corona thing.
Bapada is a comment. He says it's better to be an orthopedic physician now.
Even if you are a physician, it should not be more than 3 hours with your mask and everything on. But thing is that if you do operate, I don't mean anyway, but if you are operating, but you are being benefited by many other ways.
Ranjit Shah, how to take consent in this COVID scenario? Anything special?
Yes, I recommend, because I forgot probably during my presentation that in the green book, if you follow the green book, I refer, if you don't follow the green book, you have to write the consent form that remember these 2 points I am stressing again and again. Remember this, you write there that there is a chance of nosocomial infection. Probably I told during the lecture that there is a chance of getting corona in the hospital is very high. Second point is very frightening, I tell you. 20% of the guys who are post-op getting infected in the hospital corona, 20% is a mortality rate. So don't take it lightly. It has to be taken in your green book or else in your consent form, so that you are not in trouble. And when you counsel the patient before taking in admission, please counsel. I told after counseling this 20% my rotator cuff, then they understood that, okay, doctor, what you are telling, that is true. Otherwise, they were forcing me yesterday in the OPD that I am going to, because my junior told them, okay, you come and get admitted.
Nijhar Maji, if I'm having mild fever, what should I do regarding my duty?
No, if you are mild fever, you just self-quarantine yourself within 5 days. You'll be knowing whether you have the cough or whatever, but get tested. Test. This is the language that has been originated from Seoul. Test, and test. There are 3 things that has to be done to fight the corona. 3 things only. Test, and test.
Shobboshachi gives a warning that children are carriers, so be cautious.
Yes, obviously.
Ovijita, lockdown is a purely political entity and has no connections with biology. So right, Indro, the whole scenario has changed completely, and the sooner we accept it, the better it is for the patients and us. Perfect. Yeah, we have to accept it. There's no choice in the matter. We have to accept that. Abhishek Agarwal, any special recommendation for consultation of elderly patient with comorbidities after the lockdown period? I think the same precautions. If there are comorbidities, they will be treated. And for the elderly patient, you take all the precautions, and you're doing a consultation only. So take all the precautions that we have discussed.
I just want with your permission, I want to just give you 5 seconds me. That even after the corona, you take all the precautions, because the corona will be there, even the lockdown. Don't think that when Modi comes on, our beloved Prime Minister comes on 2nd or 1st of May, tell us that your lockdown is over after 3rd May. Don't take it like a light issue. You have to see the patient with all precautions, because unless there is hard immunity in our population, we are going to be infected. Am I true, Indra?
I'm absolutely right. Even if the lockdown is gone or whatever it is, lockdown is gone, but the corona stays. And the corona is not going to go away so easily unless we have specific equipment to fight it. So maybe vaccines, others, medicines, whatever it will come. You see, HIV has gone, dengue it hasn't gone. It's all upstate. So we have to live with it.
The earliest time the vaccine is going to come, according to the researcher telling, is 18 months.
Yes.
Earliest time the vaccine is coming in the market. So
there is some hope. You live in hope at these times. So some have said it may come in 6 to 8 months. But I agree with you. I think after all the testing is over and all, 1 year minimum, 18 months, yes.
For mass availability of the vaccine is 18 months.
Yes, mass availability, and then I'm not sure it's going to come to us. The US is going to take all of it. Rajesh Moore has 2 questions. What to do with normal specs?
I could not see here. It was not clear to me.
What to do with the normal specs? All of us have specs. Do we substitute for goggles? I think, Rajesh, I will answer this, that you use your specs, but try and use a face shield so that you can see through both of it.
And the problem is that if you use this sort of normal specs, problem is that everything is here, there, everything is open. Yes. But the specs that you can use during your PP, what you use for the HEP or the HIV, that spec, the surgical goggles is the best one.
Yes, but you can't see through it because you need powered specs, and those are not.
That is the problem. Then your face shield. Face shield is mandatory for you.
I think best that we use our normal specs, but use the face shield.
Face shield is because I operated with one proximal tibia 3 days back with the face shield only. Probably that I posted that video in our group.
The last question that I have here is from Siddharth. He says herd immunity is questionable. It may be short-lived like the normal flu. Yes, Siddhartha, that's something that we don't know. Herd immunity is what we are all banking on, but we are not sure as to what the things will be like. As the present moment goes, from what we gathered from here, there are many things that we don't know. But there are certain things which are emerging in this changed world. And the emerging thing is that you have to personally take your own precautions for yourself and for your patients. So elective operations you delay, but then once the lockdown and all is over and the patient party can come or the patients can travel with some sort of ease, then I think we have to start the elective operations. And that, as Shandendu has discussed, it is entirely a doctor's choice. And as for rape, the only thing we can say is stay safe. Everybody stay safe. Take all your precautions. Your greatest duty is yourself to your family. And then the next step is to your patients. But don't get carried away by other extraneous pressures. We have to live our own lives and we have to do our best for our patients. And we have to maintain whatever guidelines is there and whatever is available. And that's it. So we make our own decisions, but we have to do it with a lot of courage and with a lot of hope, and all the time maintaining the strictest precautions possible to safeguard ourselves. Shoe cover in OPD, Rajesh Moore's last in. Shoe cover in OPD, I don't think is absolutely necessary. If you have it, you take it, and that's it. But use socks and shoes, and the shoes that you have, as Shandendu has said, you change your shoes in some place and wear your other OT slippers or not, and then you use your shoe cover. That is possible. But if you are using your shoes and socks, it's available. But in all the kits that are there, a shoe cover is always there. It is always there. And now they're having these zipped plastic covers, which are cheaper, which has a hood and which has a shoe cover in the sense that you put it in like a pajama and you zip yourself up from the top to bottom and use your N95 mask. I think that should give us the main things, and with gloves. So Shandendu Arnab.
Another one point I want to add on that. When you come home, remember, this is a very important point. When you come home, if somebody is opening your door, don't go anywhere. Just go to your washroom. You remove everything without touching anything, and you soak it in the soap and some sort of detergent sort of thing, and that should be soaked overnight. Don't just hang on there in your washroom and just reuse in the next day. Just you have to, because you have not been accustomed to do that. So that is, you have to soak them in the detergent and the sort of solution so that it is been sterile. Don't reuse. Throw everything. So everything should be your parts, your specs, your mobile phone, these are the pure plastic, the fomites will be there for 24 hours. Your full purse, your specs, your belt, if you leave there in the washroom, whatever what is going from you, you are going to carry the specs, the mobile phone, and your purse. So this has to be sterilized in the washroom with your alcohol-based solution. Then only take into the room.
Yes, I think that's a final word. I think we finished everything, I think. Shandendu, Arnab?
Yes, sir.
Any question from your side?
I have one query. I think this question might be coming to everyone in some suburban or remote areas. Many of our doctors do chambers at their home. So in the ground floor they have chambers, and in the first floor or second floor they stay. So do you recommend doing that chamber at home setup now, or they should be stopping doing any sort of thing at their residential area?
The question is that if you are doing the chamber, the OPD sort of thing in the ground floor, and your family is staying at first floor, that is not the issue. Issue is that you have to follow the protocol, because the corona, because somebody staying in the first floor is not, some people are telling if the doctor is staying in the campus, they were throwing out the doctors. They are pelting them. But it was ridiculous, because the corona don't go with the stairs. It is not going to ride through the stairs. But thing is that you have to take care that your all the precautions are there. You leave aside whatever you are using in your chamber. Try to set off everything. Go to the washroom and make yourself clean and sterile. But spacing, telecommunication is most important. Try to reduce as many as people, refrain them from coming to your OPD, because you have to safeguard your family. You have to safeguard your patients. You have to safeguard yourself.
Right.
If I might come in on this, if there is an option of doing a chamber somewhere else, then that is always feasible, because you don't want to put anybody in your house at risk also, because patients will be crowding there. So I think about this.
Ritik, you have got some question on that. You have some, because Ritik is also have the WhatsApp number. He might be getting some questions which have not been answered.
Yes.
The main problem in the some peripheral scenario is that from periphery there are so many questions are coming that they have not this these PP like things, the shoe covers, the goggles. So what should they do at this time? And the cases, the burden of the patients is much more than these cities, the city doctors. So what should they do in this perspective?
Indra, your take on that?
Whatever burden there is, I understand this as used to seeing a huge number of patients. You have to screen out the non-essential ones, in the sense that there are many which can be dealt with otherwise. Now, essential ones you have to deal. There is no way that a person in the district can avoid that. So you have to see them with all the precautions. As for the shoe cover business and this business, and that's what I was saying about the zip suits, because these are not very expensive.
Yes.
You can use one zip suit for one OPD day. The whole thing is costly. It's costly in the sense it will come to about 400, 500 rupees for that plastic zip suit. But that is a big precaution. And the gloves, sanitizer, etc., that is there. And you have to instruct the patients that due to the current scenario, they have to wear masks. Otherwise, you won't see them. And they can only to bring one person along with them. They have to maintain the distancing. And there will be a total of, say, about 10 patients to see per day. And that's it. It is not possible to see more than that. Because that way is the only way you can decrease the viral load. Out of if you go to see 50 patients, and you're the most likely that one of them is asymptomatic carrier. And then the whole exercise of yours is gone. So 10 patients, the chances are about 1 in 10 that one is asymptomatic carrier. And in these, you do all that precautions that we have discussed before, and keep it and put it on the thing that this is the change time. This is what is being said. This is what our government tells us. This is what everybody is saying us.
You can give a notice on you there, so that
the one important thing that we haven't discussed is what I was talking to you, Shandendu, before we started this thing. There is many, the local medical associations are probably saying that why are doctors not doing their chambers or in the proper way, etc., etc.
Yeah.
and they are putting pressure on these in the districts where the pressure is huge, totally unimaginable from what we are in the city areas. So what do they do? And my answer to that is simple. You put it on record that you are not going to see more than 10 patients a day, and do all the precautions. And you put it out on your notice board, put it out on this and say, I can't see more. I won't see more. I know there will be pressure on it, but at the same time, what you're saying, look, I have not closed it properly. I'm doing the chamber, but limited. In this situation, limited.
And right there in the notice that I am available over phone from this time to this time. Is not 24/7/365.
Yes.
We are all human beings. We are all being stressed.
I think now with the mobile phones and WhatsApp, you can deal with it. So 2 hours for the mobile phone and 2 hours for the chamber, 10 patients, 2 hours, and that's it.
Sir, another point is that a lot of doctors have their own nursing home setup, small setup. So what will be the recommendations for the admitted patients indoor, and how should be they spaced out, or whether they should be kept in separate rooms or something? Is there any recommendation on that part?
No, thing is that if you are dealing with the afebrile patients and your normal CBC, CRP, LFT, urea creatinine, all these basic chest X-ray, these are all normal. They the normal spacing in the ward what you follow, because if you probably in smaller setup you cannot follow that, but the normal recommended spacing is jolly well good. If you can do a curtain sort of thing so that when the patient relative will come, and saying that, remember in smaller nursing home this time in the corona is the visiting time is once, is not twice, is not day and afternoon. The visiting time is once, and only one, not two guys, only one guy. Only one guy. So it is one visiting time, one guy will come. Understood? So there are lot many recommendations in the smaller nursing home also. You can follow this. You have to write on that, and that is the way. And
maybe by reducing the total number of bed, we can increase the space in between.
Yes, obviously, because this is because we have to. This is with Corona 2020 WC.
Right.
Rajesh says, should we remove the shoes outside the home?
Yes. Who is taking the shoes to their inside?
Yes. So outside the home, you remove the shoes, and inside it will be better. I know of a group of persons who keep a gamla of detergent water in which you put your feet in it.
Yes.
Then go into the inside of the room, which is a fair idea. I know it sounds a little bit ridiculous, but there's so many ridiculous things that we have to do now. Shobhoshachi says that the RT-PCR test or rapid antibody test are only done in a few areas. What to do in the remote areas for pre-op patients at present? Is there any guidelines by ICMR? I think what Chandendu has said, that if you can't do the RT-PCR, etc., and that I think is a must. Somehow or the other that has to be arranged. But the guidelines are what he has said. You look at the ASR, you look at the what was the thing? ESR, CRP, leukocyte, and blood count, LFT, and also, if possible, I think the D-dimer test or the that is also there. You have a look at it. You can't do at least do a chest X-ray, and then it's something that you have to take a call on. You have to tell the patient either you get it done from some other place, get it done. If it's an elective case, get it done from the nearest possible place and get a report in if you can.
Don't embark on doing just the case, doing the case for sake of surgery. Don't embark on that, because we all surgeon, we have got two things. One is the ego. Second is that we are being only way pleased is by doing surgery. So if this 2020 WC, we have to rethink.
Absolutely. We all are energized by doing surgery. This is an energized thing that we have to avoid.
Because only we two things the surgeons leave. One is the ego. Second is the pleasure we get by doing surgery.
Obviously, as a suggestion,
we are dead.
If you have the way of discouraging non-urgent cases, that you warn them that they have a fair chance of catching a much worse condition than what they have if they come to the clinic. So the chances of them contracting a worse infection than what they have is more if you come to the clinic. So that's the way you discourage them.
Yes, discourage them. Tell them if you come here, you might get infected from the hospital.
Yes, because the other 10%.
The choice is yours.
Yes, the 10 persons are there. Arnav, are we through now?
Yes, sir. I think we have discussed
All the
every bit
questions.
of it, every aspect.
Yes.
And I think our conclusion has been made very clear by the nice talk and the discussion, and all the practical tips and tricks has been shared, and those will be useful for our day-to-day practice. So I think so with this thing we can end our today's discussion, and we'll have some words from Dr. Samanto.
Yes. Thing is that this was the idea of our dear Bappada, who is in Malda. So he is also the past president of West Bengal Orthopedic Association. He ignited the idea that Swarnendu, please we can hold one meeting on what to do with the corona. So he told me. So then I talked to my junior brothers like Arnav and Ritik. They are the high-tech guys. They have done all this YouTube job for us. And as always, Indoda is our lighthouse. Whenever we are in trouble, so we go to Indoda. So that is the only solution we are left with. And Indoda is the person who successfully did the IOCON. You know the stature of the IOCON, what we did in Kolkata. Probably that has been landmarked. And now the people, those who are going to do next year and next to that, they are thinking how to do the IOCON like Kolkata. Probably they cannot surpass us. Okay. So
Yeah.
He's the lighthouse.
Swarnendu, the only thing I bless my lucky stars and bless everything that we did it before the corona.
Yes, we did.
Exactly.
We did that.
Exactly.
And I think all the people who are listening, West Bengal Orthopedic Association, even those who are listening throughout the country, that whatever WhatsApp the flyer you have got, one was done by Arnav and one was done by me. This was the first flyer we have designed by staying at home, work from home. Thank you.
Legend.
Thank you, Swarnendu, for a brilliant.
Thank you, sir.
Thank you, sir.
Thank
Thank
you,
you,
Ritik. This was marvelous.
Thank you. Take
Thank
care.
Thank you, sir.
Take care. We can
Okay.
go offline. Indoda, we can
Yes.
go offline, but we'll be staying here for some time.
Yeah, as I said before also, we are locked but not down.
Yeah.